In this video, we shall learn the technique of IV fluid preparation. Take all the things required for IV fluid preparation in a tray. This includes pair of sterile gloves, syringes of 5 ml, 10 ml and 50 ml each, spirit and betadine swabs, fresh and unopened IV fluid bottles, cap, mask, gown, pressure monitoring line or sterile extension tubing for giving IV fluid through infusion pump, 3-way set and a pediatric drip set. For IV fluid preparation, we require at least 2 people. One nursing officer prepares the IV fluid in an aseptic manner and the other nursing officer acts as a helper. Both of them wear cap and mask and perform hand hygiene using hand washing or hand rub. Thereafter, sterile gown and gloves are worn. Clean the surface on which IV fluids and injections are going to be prepared with a swab soaked in disinfectant or 70% alcohol. Remember that thorough cleaning has to be done each time the IV fluid is prepared. Remove gloves and wear fresh ones. After cleaning the surface, place a sterile sheet on it. The helper peels off the outer cover of various disposables and puts the various supplies onto sterile sheet in an aseptic manner using non-touch technique. Nursing officer preparing IV fluids now cleans the top of the surface of IV fluid bottles with spirit swab, followed by betadine swabs, followed again by spirit swabs. Already opened bottles should not be used. Remove gloves and wear fresh ones. Connect the tubings of pediatric drip set to the IV fluid bottle and fill it with the volume of fluid required for 8 hours. Take 10 to 15 ml extra fluid in the burette to flush the lines. Nursing officer flushes the lines of a pediatric drip set using the roller controller on the IV drip set. Now connect the tubing of the pedia set to the IV cannula which is attached to the baby. For infusion pump, the nurse fills the fluid volume required for 8 hours in a sterile 50 cc syringe from the IV fluid bottle. Then attach pressure monitoring line or a sterile extension tubing to the 50 cc syringe. Flush the pressure monitoring line to remove any air bubbles present in it. Clean the port of the IV cannula with spirit swab by at least 15 to 30 seconds. Scrub the hub technique. Now connect the pressure monitoring line to the IV cannula attached to the baby. Important points to be remembered during IV fluid preparation are: the nursing officer holding the prepared IV fluids should not touch any unsterile surface prior to connection of the fluid to the baby. Always first connect the extension tubing to the IV cannula and then attach the syringe into the infusion pump in order to prevent contamination of the baby's end. Once the buttons of the syringe pump are touched, take care not to touch the IV cannula or the baby's end of the tubing again.